Thank you so much, Mr. Chairman. And as we wrap up here, I join the others in thanking you for how you have conducted this markup and for answering or trying to answer my many questions, as well as thank Ranking Member Pallone and, of course, the fantastic staff here and all the advocates who've joined us over the last 25, almost 26 hours now and long before to help inform and help us make smart policy. And I support this amendment, and I think it's important that this bill cannot take effect if its provisions result in reduced access to health care coverage. And that is what we have been talking about for the last 25 hours. Throughout this markup, we have talked about big issues and all the ways we know it's true that the things we've talked about over the last day are the likely outcomes of the legislation that we're marking up. We've been here a long time. I know we've said a lot of things over and over, but I hope that repetition has registered because we have been here before. So many of the things that Republicans are proposing to do in this bill, states have tried them and they have failed. We heard cautionary tales from Arkansas and Georgia, as Dr. Ruiz recapped, and we've heard cautionary tales from Texas. As I discussed earlier, defunding Planned Parenthood has failed by every metric, and it continues to fail Texas women. And in Texas, we saw recently the redeterminations after the moratorium on Medicaid disenrollments at the end of the COVID pandemic is also a cautionary tale. Texas didn't allow for automatic renewals, forced almost all the beneficiaries to resubmit their documents to prove that they were eligible, the kinds of things we're talking about in this bill, and almost 1.4 million people lost coverage for procedural reasons, like what we're talking about here, failing to submit a form or making an error. It was not because they were not eligible for coverage. Nearly 1 million, just shy of 1 million of those people were children. And we have another cautionary tale from Texas, and I think it's important to know. In 2003, in order to reduce the enrollment and cost of CHIP, the Republican Texas legislature passed a bill requiring twice-a-year enrollment, much like the one proposed in this bill. And while proposed as ensuring eligibility, it was an absolute disaster of the state losing paperwork, and it became a tragedy for families. A friend was just telling me about a Houston child, Devontae Johnson, who had a treatable form of cancer back in 2007. Devontae's mom was a paralegal, and she was so diligent about getting all of his forms in on time. She knew his cancer treatment required CHIP coverage, and she did everything right. The state of Texas lost his paperwork. And when she couldn't get help, she finally turned to our former colleague here, Congressman Sylvester Turner. And he was able to help Texas Children's Hospital resume Devontae's treatment immediately. But because of the pause in his treatment, when he lost his coverage because the state lost his paperwork, his tumors returned and they grew. Representative Turner passed HB 107 in the Texas legislature in 2007, and that eliminated this twice-a-year requirement. And I just want to point out, this policy was so bad that the state of Texas repealed it. It made an immediate difference in enrollment, but it was too late for Devontae. He died before the bill became law. Let this lesson be a story now, before it is too late, before you vote to increase the frequency of eligibility verifications. Let's not make the law that was so bad in Texas become the law of the land across the country. Let's listen to each other, and even if we aren't persuading each other right now, let's listen to the doctors and the people who are telling us what this means in real life. Let's be smarter. Let's learn from these failed experiments in the states, failures that the CBO considered when it reached its conclusions about this bill, failures that we should consider here before it is too late, before nearly 14 million Americans lose their health care. It's not too late. It is not too late to do the right thing by and for the American people. Thank you, Mr. Chairman. I yield back.